This disorder affects 1 out of 4 adults and can have profound health consequences. Fatty liver, or hepatic steatosis, is the accumulation of fat in the liver defined as greater than 5%. Metabolic dysfunction associated with steatotic liver disease is a common disorder that impacts more than 25% of adults. This process is associated with endothelial dysfunction, which is a driver of heart attack and stroke, heightened diffuse systemic inflammation, and ectopic fat deposition where it doesn't belong in other organs. Contributors to fatty liver include a high consumption of refined carbohydrates, sugars, and unhealthy fats, the characteristic standard American diet, sedentary lifestyle and lack of physical activity, metabolic conditions like obesity, insulin resistance, type 2 diabetes, and high cholesterol, and a family history of fatty liver or related metabolic disorders. There are certain drugs like corticosteroids and exposure to environmental toxins that can cause fatty liver, and alcohol use, even in relatively small amounts, can give you fatty liver. The persistent fat accumulation in the liver triggers inflammation and damage, progressing to steatohepatitis. The liver's inability to process toxins effectively can lead to chronic fatigue and general malaise. A compromised liver can affect the immune system, increasing susceptibility to infections and delaying how quickly you recover from injuries. Fatty liver is closely linked to metabolic syndrome, increased risk of heart disease and stroke, and type 2 diabetes. Long-term inflammation results in scarring or fibrosis of the liver. A severe condition called cirrhosis impairs liver function, and you can have an increased risk of liver cancer.